Hello, good evening everyone. Nice to be here for another Q&A. Just want to start off by saying sorry about last week's horrible video and audio quality. As some of you may notice, I'm in a new space because last week I moved. And I didn't have my proper setup, but I didn't want to postpone the debate I had planned. So I went ahead and did it on my laptop, which was not a good choice because nothing was working and it was super distracting. So the audio and video quality are not going to be good there. Sorry about that. I can't really fix it, but I figured I'll just leave it up as is because you can still hear most of it even though the audio cuts out at the end. But anyway, we're here now. And before we get started on today's Q&A, I'm just going to have time to let the questions fill up. I'll talk about two things before I start answering questions. First of all is just I want to do a quick little recap, I guess, of last week's debate. So essentially what happened was this guy, Matthew Crawford, who is a friend of Steve Kirsch, and if you know who Steve Kirsch is, you know he's awful. He started off the debate saying that Covid PCR tests have a lot of false positives. And in order to begin defending that position, he referenced this old paper, which I was familiar with. It shows that over time, it shows that as the CT values get higher, so the CT value is the cycle threshold value. It's the cycle at which a sample tests positive. So a PCR test could run for 40 cycles, and a sample might pass the cycle threshold, indicating that it's positive at cycle 22. The CT value for that sample is 22. So as the CT values go out and get larger, these researchers found that higher CT values they could not culture live virus from. So what does that mean? It just means that they couldn't culture live virus. Does that mean the person is not infected with SARS-CoV-2? No. No, because the COVID PCR test found nucleic acids belonging to SARS-CoV-2 in that person. And when someone takes a sample from a patient and does a PCR test, it's essentially a snapshot of what that person is, what's happening in that person's nasopharynx at that time. So if I had a PCR test done, and let's say I just got infected yesterday, maybe there's a little bit of virus in my nasopharynx, and maybe even my nasopharynx is a little dry, maybe the swab didn't pick up much material. Lots of factors can influence what might happen here. But let's say I got infected yesterday and my CT value for my test is 35. Probably not going to recover any live virus from that, but if I waited 2 days and tested again, and then there's a lot of virus in my nasopharynx, it could be that I have a CT value of, say, 25. Good chance you're going to recover live virus from there. So the whole point is that this discussion about COVID PCR false positives is muddied by the fact that people don't understand what PCR is supposed to tell you. It's supposed to tell you whether or not you're infected with SARS-CoV-2. It's not supposed to tell you whether or not you're sick. It's not supposed to tell you whether or not you're infectious. It's supposed to tell you whether or not you're infected. And we're not going to know if you're infectious, if you're infected. In order to figure that out, we have to do lots of other tests. Tests that are not feasible to do on a large scale, tests that take a long time, tests that are expensive, and you're just not going to do that for a lot of people. So that's why the guidance has always been, if you are COVID PCR positive, you should act as if you are infectious and just stay on the safe side, because you don't want to spread it on to other people, and you could be spreading it to other people even if you don't have symptoms. That's always what PCR has been about. There has never been an issue with false positives with the test. We've seen that in all of the real world data, which Matt didn't want to talk about. He didn't seem willing to address that. So, conversation didn't really go anywhere after that. So, I asked him if he would be willing to discuss vaccine safety at a later date. He said no, and since then he's practically been ignoring me. So, I don't think we're going to hear from him again, at least not on my channel. So, next time I do a debate, I will make sure to use this normal setup and never use my laptop again, because, yeah, that was really frustrating to deal with a bad setup. And I know it was for anyone watching too. The audio was bad. My video was cutting out. My mic cut out. So next time will be better. The other thing that I want to talk about before getting to questions is this new thing that everyone's talking about. A paper published in JAMA Pediatrics found trace amounts of COVID mRNA vaccine in breast milk. So people are freaking out about this. You can already see the comment section in this Twitter thread is just a dumpster fire. It's awful. So what does this mean? Well, the researchers did RT-PCR, so basically COVID PCR test on RNA extracted from human breast milk. So suddenly, COVID PCR works in this case for anti-vaxxers, and they are very upset about it. So, of the subset of this very small number of patients they tested, only 11 people were enrolled in the trial, or in this experiment. They detected COVID mRNA vaccine, mRNA from a COVID mRNA vaccine in 7 samples from 5 different different participants. So 5 out of the 11 women were who were lactating had positive samples for mRNA. People are upset because they thought that this wasn't supposed to happen, that this person says that this wasn't supposed to happen. How many people were deplatformed for suggesting this in the past? Well, in the past people had tested for mRNA, COVID vaccine mRNA in breast milk and hadn't found any. So that's why people were saying it's not in breast milk, because it wasn't found. In this particular test, they're not doing anything nefarious, they're not doing anything fraudulent, at least at face value. They're not doing anything wrong. They managed to find trace amounts. But what's important here is what they mean by trace amounts. So if we go to, here it is. If we go to the concentration amounts that they actually found, we're talking about picogram per mil amounts, at most 16. That's about 1/3 of what you would find in a typical Pfizer vaccine. That's really, really tiny. And this was only found for a limited amount of time after the vaccine was given, a very short amount of time. So this isn't a permanent thing, because these vaccines are not permanent. And it's trace amounts. So what's happening here is the vaccine gets injected into the arm, and some of it's going to seep into the blood, but most of it's going to stay either in the injection site, or go to the liver to be degraded, or picked up by antigen-presenting cells, taken to lymph nodes, and processed by the immune system to create an immune response and immune memory. So the amount that seeps into the blood, and possibly the amount that is carried to the lymph nodes, which are in the armpits, which is close to breast tissue, could be getting trace amounts, again, picogram per mil amounts, into breast milk. Now, again, just to drive home how tiny this amount is, picogram per mil is 10 to the negative 12. 10 to the negative 12 units is what picograms is. It's so tiny. I mean, just this amount would not be biologically active if you injected it into a person. It wouldn't do anything. It'd be way too few molecules to have any biological effect. Furthermore, this is breast milk that is being consumed by a baby. It's going into their mouth, going through their digestive tract. There are plenty of enzymes in the mouth. Oh, you can't hear? Is the sound good? I'll wait to continue until I hear. It's just one person saying they can't hear. Can they actually not hear? Okay, I'll just continue. So, the baby is consuming this stuff, and there are plenty of enzymes in the mouth, the esophagus, the stomach, that are going to degrade RNA. It's not going to be an issue. It's not going to do anything if you inject that amount, and it's certainly not going to do anything if you consume that amount. This is not something to worry about. This is not something that anyone should be concerned about, and it's not really surprising because it's such tiny amounts. Even though we didn't find it before, it's still just such tiny amounts. So, this is the new thing that people are freaking out about, but again, it's really nothing. It is absolutely the best thing to do to get vaccinated, even if you are pregnant and close to giving birth, or if you're breastfeeding. Why? Because if you get vaccinated before you give birth, then you're going to protect not only yourself, but your baby from severe outcomes from COVID. And when you're pregnant, you are immune compromised. So you're more likely to suffer severe adverse events from infectious diseases. So you definitely want that protection. Furthermore, you pass that protection on to your newborn through passive immunity. You pass antibodies down to them, you pass T cells down to them, and you will also continue to pass antibodies through breast milk if you are able and choose to breastfeed. So those first 6 months of life are pretty important for your baby to have that passive immunity from the mother. So the extra protection is great. Okay, so that's all for that stuff. Let's get to some questions. Let's see. I'll start at the top here. Keith is asking about a new peer-reviewed study by scientists at the Scripps Institute finds hydroxychloroquine is indeed effective against COVID. Okay. Why has it been suppressed as a treatment? Because it doesn't work. So let's see. I assume... Let's see, Keith. Are you talking about this paper? Hydroxychloroquine blocks SARS-CoV-2 entry into the endocytic pathway in mammalian cell culture. So, just from the title, this is not showing that hydroxychloroquine is effective against COVID. This is saying that they found a mechanism that allows hydroxychloroquine to block SARS-CoV-2 entry into cells in culture. Plenty of drugs can do this. This does not show that it treats COVID. In order to show that it treats COVID, you need a clinical trial. And there have been several clinical trials done with hydroxychloroquine in COVID. It doesn't work. Showing that it does something in cell culture does not change that. Sorry. It just doesn't work. Just let it die. Deb asks, do you think COVID infections are being underreported? Yeah, probably. I think it's safe to say that no matter what time of the pandemic we've been in, COVID infections have been underreported. And even now, with a lot of people testing positive at home with antigen tests and not reporting it, those are definitely getting missed. Keith is asking where Carrie Mullis is when you need him. Oh, God. Yeah, for those who don't know, Carrie Mullis had a good idea to conceive basically the foundation of the original PCR test, and then he descended into just wackadoo territory. That's pretty much his legacy, because even though he won the Nobel Prize for coming up with the fundamental idea behind PCR, he said a lot of wrong things. But one of the things that he was right about in his original patent for PCR and some of his papers was that you could use PCR as a diagnostic tool, which we do today. And we use a better method called qPCR, which he did not invent. So anytime someone mentions Carrie Mullis, it's just always a cringe fest. Keith also asked, weren't we promised that it would stay in the deltoid and be eliminated in a couple of days? Yeah, that's pretty much what happens. Most of it's in the deltoid. If it's not in the deltoid, then most of it's either going to the liver to be destroyed or to lymph nodes to be processed by the immune system. The rest is just trace amounts or tiny amounts. Okay, Paul asks, what would you rate your level of concern with getting COVID if boosted with bivalent? Would you go maskless? So with bivalent boosters, just like with any vaccine, you're not going to get long-term protection against testing positive. In other words, you're not going to get long-term protection against infection. So don't expect to never test positive if you get a bivalent booster. Expect to be protected against disease, which is what matters. Would I go maskless? I don't wear a mask in a lot of places now, but I continue to wear masks on public transportation. I don't go many places having a 1-year-old. But yeah, pretty much public transportation is the only time that I wear masks still. And I will probably continue to do that forever because it's gross when you think about it. Just breathing other people's air, as Vincent Racaniello said. I think that puts it nicely. It's gross. People are coughing and breathing, and you're just breathing in their air. So, yeah, that's where I wear masks. And I don't think getting a bivalent booster would change my behavior. But I don't go, like I said, I don't go many places. I go to work, I go home, and I take care of my kid. Okay, let's see. Next question is, Why would the spike protein be concerning in the first place? Isn't the mechanism of being vaccinated? Isn't that the mechanism of being vaccinated in the first place? So I think what you're asking is, so if this is in reference to the breast milk thing, it wasn't the spike protein that was found. It was the mRNA that's in the vaccine. Yeah, to my knowledge, I don't know of any evidence that spike protein is shed in breast milk following vaccination. But yeah, either way, it's not really a concern. Unless spike protein is there in really high amounts, it's probably not going to do anything. Your stomach acid has an enzyme called pepsin in it that's going to break down a protein like the spike protein. And if it's there in low quantities, it's not going to really exert a biological effect. But what we do know is shed in breast milk are antibodies, which is the point of vaccination, to induce the immunity in the mother and have it pass passively to the baby. Next question is, why does the COVID vaccine rarely cause more intense periods for women? I assume this is other vaccines as well. Yeah, so if you want to learn more about this, I would definitely check out Jen Gunther. She is what's her title? I don't want to say her wrong title, and I'm not sure what it is right now, but she is a scientist, and she does a lot of communication on women's health and COVID vaccines and all that stuff. So again, Jen Gunther is who you want to check out for that, for details. But let me find that question again. Yeah, so the periods. As far as I understand it, lots of things can affect cycles, including stress, exposures to antigens, exposures to viruses, so basically immune responses. So yeah, stresses on the immune system, stresses in life, different dietary changes, lots of things can affect your cycle, and it's not necessarily harmful. So I don't think it's too surprising that women were experiencing it, and if it's not associated with any negative health outcomes, then I don't think it's really a concern. Paul asks, are you boosted with the new bivalent? Not yet, but I will be. I will be getting it this fall. Someone, my name 825, asks, shouldn't we be focusing on prevention of spread, for example, air filtration and ventilation? That would be a good idea. Not just for SARS-CoV-2, but for all respiratory viruses. Yeah. Simple prevention methods like air filtering, ventilation, masking when you're experiencing symptoms or you think that you're infected with something. Like, for example, I usually don't wear a mask to work anymore because, I'm not really around. I'm not really in close proximity with people a lot anyway. But when was it? About a week or two ago, I had symptoms of hand, foot, and mouth. I got a really mild case, I think. I could see sores in my mouth, but I didn't get any on my hands or feet. And yeah, I felt pretty crummy. So I wore a mask and made sure to stay away from other people. And I didn't have sores on my hands or anything, so don't think I was too contagious. But yeah, just like wear a mask when you think you might be infected with something. If you have the power to, then be conscious of ventilation and air filtration. Those are all good things. It's weird that my sound is different from slides to video of myself. I don't know how to fix that. Paul also asks, but how do you suppose placebo/reverse placebo factors into adverse events and purported ivermectin, etc. efficacy? So yeah, placebo and nocebo effects. The way to think about them, a lot of times when people talk about those, they talk as if it's the mind causing those effects to happen, like the mind causing a good effect, the mind causing a bad effect to happen. But really, the better way to think about it is that good things will happen on their own and bad things will also happen on their own. And their association in time with, say, taking a pill or getting a vaccine is what we call the placebo-nocebo effect. So, I told this story, I think on a podcast. I don't think I told it on my channel, but so the week before my daughter got her first dose of COVID vaccine, we heard that there were cases of hand, foot, and mouth in daycare. And we were like, oh God, okay, so she's probably going to get it. And then she didn't get it. And then the day before her vaccine, I noticed some sores in her diaper area. And then the next day she got the COVID vaccine, and then the symptoms really started to show up. That would be a nocebo effect association. She was going to get those symptoms anyway, because we knew that she had been exposed and the virus was doing its work, incubating, starting to cause those symptoms, even before she got vaccinated. But a nocebo effect association is going to make someone think, oh, it had something to do with the vaccine, when really it was just going to happen on its own. And same thing with the placebo effect. If you have a headache and you take Tylenol, the next morning you feel better, but then do a what if and redo that same scenario, exact same variable, situation, whatever, and you don't take Tylenol and the next morning you feel better, then that just means you were going to feel better anyway. That's placebo. And I think that does play a part in, of course, vaccines and ivermectin, because a lot of people who get COVID feel fine just on their own without any intervention. So if they happen to be taking ivermectin, they're going to associate it with them getting better, and that's going to be a placebo effect. Okay, so moving on. Sorry if I'm rambling in some of these questions. Keith, again, is asking, why is Paul Offit not getting any more injections? Why did he vote against unleashing the new bivalent shots in the public? Because he is looking for evidence that the new bivalent shots are going to be better than what we already have. He thinks that the current 2 to 3 doses are, he thinks that the current 3-dose regimen of COVID vaccines is all we need. He thinks that is giving us all the protection against disease, death, hospitalization that we need right now. And there's no data so far that these bivalent vaccines will offer any significant benefit over what we have. So that's why he's voting no. That's why he's not convinced we need to keep boosting. So he's, to any anti-vaxxers out there, I don't know who needs to hear this. If you're an anti-vaxxer, Paul Offit is not on your side. He just is not. He just has different opinions on what we need right now. And that's fine. We can disagree. I personally think that bivalent vaccines are worth having, because the only way we're going to know whether or not these bivalent boosters are going to give a significant benefit in terms of death, hospitalization, severe disease over what we already have is to wait for more people to get sick and suffer. And so, we have to wait for people who have gotten 3 doses to continue to be infected and start suffering severe disease. And then we have to see in the population whether or not a 4th dose is preventing that at all, reducing those numbers. So I think, why not? Why wait for that when we already have data showing that these bivalent boosters do expand human immune memory past what we see already with just 3 doses of monovalent. We have data coming out of Ali Elabedi's lab showing that. So I think they're worthwhile. And SARS-CoV-2 is just going to continue to evolve and spread. And having updated vaccines is a good move to be prepared for any future variants that might escape immune memory. And Paul Offit disagrees, but that's fine. We can disagree. It's okay. Disagreements can happen in science. He also didn't think that we needed a 3rd dose, but then Omicron came and changed his mind. Now he thinks that COVID vaccines are a 3-dose regimen. So we'll just see what the data say, and in the meantime, get your 3 doses at the very least. Okay, moving on to more questions. Carrie Mollusk. James Turner asks, what exactly does vaccine create in regards to spike protein? Specifically, I have read expression of spike protein, piece of spike protein, harmless spike protein, etc., etc. Yeah, so the COVID mRNA vaccines introduce mRNA into the cell that code for spike. So it's going to get translated or read by the ribosome such that it's producing protein. So it's going to produce spike protein, which is modified from wild type spike protein. And the bioactivity of it isn't super different in terms of what we see, like with binding or susceptibility to enzymes and whatnot. But what is different is that it's just the spike protein, it's not the whole virus. And it's much less than what a virus would produce in your body. And it's all being it's not constantly replicating. It's just all being relatively contained at an injection site, which is already having a lot of white blood cells, antigen-presenting cells being recruited to that area to chop up the spike protein and present it as antigens to other cells in the immune system. So it's going to get, it's not much spike protein compared to an infection, and it's going to get chopped up and inactivated pretty quickly by immune cells. Okay, Paul Wilson, no relation, asks, I think your debates with vaccine/COVID skeptics would be more effective if you agree in advance and in detail exactly the points of disagreement you are going to discuss. Yeah, I agree. Let's see. I didn't start trying to do that until I think like my 4th debate on the channel, where he actually sent me slides that we were going to go over, and that was helpful. we didn't get through many of the slides because we got stuck pretty early on something that he would not budge on. But yeah, that was helpful. And with this most recent one, I tried to, through email beforehand, say like, what are we going to talk about? And he said specifically validating validating COVID PCR tests in vaccinated versus unvaccinated people, which we didn't really get to. He kind of went off topic a lot, but I was very tired and not on my normal setup, and so I just wasn't trying to keep him on track as much as I would normally be able to. But yeah, it's a good rule for me to have in the future. And yeah, just by the way, the whole idea that COVID PCR tests work differently in vaccinated versus unvaccinated was completely ridiculous. There's absolutely nothing in biology that would say that a vaccinated person would have a PCR test behave differently on their samples than an unvaccinated person. Nothing in viral evolution, nothing in biology in general, especially with a qPCR assay that is targeting more than one site on the viral genome. It's just not going to happen. You're not going to see a difference. Okay. My name asks, wouldn't Novavax be better now that it doesn't just focus on one part of the virus that mutates? So, Novavax, is that just the RBD? I don't remember this. To answer your question, not really, because the mRNA vaccines encode the full-length spike, so it encodes the full protein, so you're going to have antibodies targeting multiple different epitopes all over that spike protein. And you're also going to have T cells targeting multiple different epitopes all over that spike protein. So it's going to be really tough for the virus to evolve enough to escape both neutralizing antibodies and T cell epitopes. If it did that, then it would be a completely new virus to our immune system. But it's not going to evolve to do that anytime soon. It needs either a lot of time or just like a really prolonged chronic infection in a sufficient number of people in order to generate that many mutations. Okay, I was looking at okay, so yeah, Novavax vaccine, I believe, is just the it's just the RBD, right? Am I getting that wrong? So if it's just the RBD anyway, that means it's just part of the spike protein. It's just the part that, it's the receptor binding domain. That's what RBD stands for. Yeah. No, is it the full length spike protein in Novavax? I get so distracted trying to look things up in real time and look at the chat at the same time. Either way, it's not going to make a difference in the context of your question. So yeah, moving on. Okay. El Viraj asks, college student who got sick with COVID a week after moving into college, who had 3 shots previously, how long should they wait to get that bivalent shot? As far as I understand it, you can get a booster dose anytime after your infection. I don't think there's a reason to wait. But double check, you know, if you're really curious, check with your doctor about it, or the any CDC guidelines that might say otherwise. But I'm pretty sure that there's no reason to wait. Henry asks, are you planning to make a video covering the recent Picard et al. And Warabi et al. Papers on the origins of COVID? I wasn't really planning on it. In my opinion, the COVID origins debate is it's resolved. It's not really interesting to me anymore. I don't think, I've made some videos about it, and I don't think that the Picard and Warabi papers really, like, I don't think that my channel would really need to cover them. They do a pretty good job of just confirming or reinforcing, rather, what we already pretty much knew, that the virus originated in the Huanan seafood market and spread from there. So no, I'm not planning on making videos about those papers, but they're very good to check out if you're interested, in that topic. Let's see. Late night break. You're very welcome. Thank you. Question, what about all this stuff about menstruation? Where can I go to read on its validity? Follow Jen Gunther. And Vicky Mail. Vicky Mail is on Twitter. Jen Gunther is on Twitter and has a Substack. If Vicky Mail has other stuff, then she'll have it on her Twitter. I can't remember if she has a Substack or whatever now. But they're both great to follow on those topics. All right, Cheryl asks, which individual do you think has caused the most damage to COVID vaccination program, referring to COVID in particular and not general anti-vaccine misinformation, and why? That's a tough question. That's a tough question. Who has been the most influential COVID anti-vaxxer? I'd have to think about it more, and my answer would probably change the more I think about it, but on the spot, I'm going to go with John Campbell, because he presents himself in a way that seems reasonable to the average educated person. And that, in my opinion, is very dangerous. To come off that way and be pitching disinformation the entire time, swaying otherwise reasonable people, and also being a reasonable person that anti-vaxxers can share, is just, it does a lot of damage. And I have seen his stuff that he says in his videos, which I'll find out way later because I don't keep up with his videos, but I'll find out way later. I'll like get a lot of messages all about the same thing, and I'll wonder, like, oh, so, well, someone's amplifying this. I don't know what's going on. And then later I'll find out, oh, it was in a John Campbell video. He said it, and now everyone's sending it to me and talking about it as if it's true. But he is so far gone. All right. Will will you invite Riza Islam to debate on vaccines? I've actually direct messaged him. I've never gotten a response. Paul asks, you don't believe in true placebo? It's a repeatable, statistically significant effect. No. Even if not paranormal, this could be explained by attitude affecting stress hormones, vagal tone, etc. Yeah, so the placebo effect, again, as I understand it, is most strongly measured in trials or experiments that are measuring pain and emotional stuff. So, for example, a placebo effect is not going to cure cancer. A placebo effect is not going to clear a virus from your body. At least not one that is triggered by, physiological effects caused by changes in mood or stress or things like that. So that's what I was referring to mostly with the placebo and nocebo effect. In fields of pain and emotions and stuff, it can be more complicated because that stuff does have to do with mental states and stuff like that. So yeah. Okay. Tony asks, there's this... My dog is sleeping and barking in his sleep now. There's a certain plague enthusiast on here trotting out the old canard that vaccination makes no difference to spread, but surely it does if a vaccinated person can have a shorter infectious time. Yes, exactly. That is exactly what COVID vaccines do. They reduce the period of shedding. So they are reducing your chances of spreading it to someone else. And not only do they reduce the period of active virus shedding, but they also reduce the amount of virus that people shed. That's been shown in studies that actually look at that stuff by measuring infectious titers of virus, which is the right way to do it. Not just PCR of RNA levels. You have to do infectious titers. And those experiments show that vaccines reduce transmission. Okay. What Hanif, sorry if I'm not saying that name right, asks, what medical misinformation / conspiracy theory will you tackle next? HIV hoax, vitamin megadose, transphobia. Okay, so I think that on this channel I'm mostly going to stay on the topic of COVID vaccines or vaccines in general, because that was the original, anti-vaxxers was the original topic of this channel when I started it. And I think I'm going to stick with that. So I don't really have any plans to go more into the HIV conspiracy theories or vitamins or anything like that. But yeah, those are my plans. Deb asks, have we reached or are we even close to herd immunity? So this concept was, I think it was communicated very poorly. Herd immunity is going to look different depending on the disease, essentially. And herd immunity might not be a concept that applies very well to SARS-CoV-2 because it's a coronavirus and a respiratory virus that spreads pretty efficiently, and our immune systems contract over time, which means our neutralizing antibody levels go down and leave us susceptible to infection, but not necessarily susceptible to getting really sick or having severe disease. It's not really clear how herd immunity is going to work moving forward with SARS-CoV-2. So no, we have not reached herd immunity, I don't think. But we've definitely reached... So if you're thinking of herd immunity in terms of infection, we're definitely not there, and it's not clear if we'll ever get there. But if you want to think of herd immunity in terms of like nobody's getting severely ill or going to the hospital, or SARS-CoV-2 is not having a disproportionate measurable impact on public health, then we're close. We're close. We just need more people to get vaccinated, because most of the people in hospital, in the ICU, dying are still unvaccinated in the U.S. Hopefully that makes sense. Okay, let's see. Michael Holloway asks, as of 20 years ago, university faculty refused to go on record refuting right-wing pseudoscience. Now that they've expanded into public health and adopted anti-vax, what has been your experience with fellow faculty? Is there sufficient awareness? Do they want to be involved? So my experience, when I was in academia, I now work in industry. But when I was in academia and I was doing my YouTube channel, reactions would be pretty mixed between like, oh, you're wasting your time, why are you doing that? And oh, that's great, that's really awesome. I wish I could do that. Dedicate time to that kind of thing. That's the kind of spectrum of reactions I would get, and that's among both faculty members and postdocs and PhD students. That spectrum applied to all those groups. I think generally scientists in academia and in industry just don't care to try and address misinformation. A lot of people in these fields just work hard. They want to do their work during the day, go home, and enjoy their lives. And when they work hard, they're doing good work. They're not just passively, doing work and not questioning or anything like that. But it takes a lot of energy to learn about these conspiracy theories, like what they're actually saying and where their claims are coming from, and then do the work to find the specific information that debunks it. So it's a lot to ask of like an academic researcher to do, or someone who works running clinical trials, or doing biological sample testing. It's a lot to ask to anyone. But I think that the attitude in academia that it's a waste of time is unfortunately still fairly strong. They'll talk within departments about how bad disinformation is and how stupid people are, but they never want to really engage or do anything to help educate the public. Yeah. Hopefully that helps answer the question. It's been a mixed experience with other scientists. Scientists generally hate misinformation, but just don't have the energy, time, or will to do things about it. Okay. Another question from James Turner. For Omicron, what is most recent data on vaccination immunity versus immunity from being infected by Omicron? So, if you've been previously infected before Omicron, and then you get infected with Omicron, it's not a great immune response. It's a phenomenon called imprinting, where your immune response is geared mostly toward a previous variant that you've been infected with. So, for example, Delta or Alpha, whatever, and geared less toward Omicron. That's what data have shown so far. But with vaccination, if you repeatedly get exposed to the spike antigen in the context of vaccination, your immune memory is going to expand such that it encompasses all variants. So, vaccination is better than infection in that context. But if you have never been infected with COVID and then you get infected with Omicron, your immune response is mostly geared toward Omicron, and it is better than if you had been infected before with a different variant. Okay, Chris P. asks, my wife and I have been living extremely carefully for nearly 3 years now. We recently got Moderna's bivalent targeting B1. Is it reasonable for us to start foregoing masks? Look, if you're up to date on your vaccines, you're protected and you're not going to be around people who you think are particularly vulnerable, then it's probably fine if you forego masks. I personally would still wear masks again on public transportation and stuff. That's just me. And if I was around people who were especially vulnerable, I would consider it. But I think it's fine if you don't want to wear masks anymore and you're fully vaccinated, and you're not around vulnerable people all the time, then you're okay. Juror number 13 asks, when anti-vaxxers say spike protein from vaccine is bad, isn't an infection worse because it produces significantly more of the same protein? Yes. Yes, it produces much more spike protein, and it produces a whole freaking virus. So you have a virus replicating in your body, going into your lungs, into your nasopharynx, it's getting into your blood, it's infecting your organs, and it's possibly driving your immune system into overdrive because it's virus replicating a lot. Whereas a vaccine, it's a one dose of something, and it's not going to replicate. It's going to produce spike protein, but the molecules that code for the spike protein are not replicating. So you're getting a lot more virus. So yeah, it doesn't make any sense when anti-vaxxers complain about spike protein in vaccines, but are somehow fine with a virus just spreading rampantly across a population. Church of Sagan, hello, asks, are you really a fan of funk, or is Big Pharma just paying you to appeal to music nerds? Also, do you plan to check out the Taylor Hawkins tribute live stream tonight? I am a fan of funk music. My dad played funk music from the 70s and 80s a lot when I was younger. I've seen Earth, Wind & Fire live. I love it. But no, I don't think I'm going to check out the Taylor Hawkins tribute live stream. Unfortunately, after this live stream, I'm probably going to go to bed so I can get up early and go to work. But yeah, I love funk music. And Earth, Wind & Fire was great. We had a front row seats. It was incredible. There's only 3 members alive from the original group, but man, they're awesome. Okay, moving on. Okay. I'll just address Zach Attack here. Is that why they still use the original vaccine for Omicron and still have to get those 3 original vaccines before you get the new updated one? I'm not sure what your what that question is in response to, but just so you know, 3 doses of the original mRNA vaccine. When you do that, when you're exposed to an antigen over and over again, your body does something called somatic hypermutation and B-cell maturation, which expands its memory. So it's basically B cells are going to school each time you get exposed to the antigen, and they're learning more about the antigen. They're getting selected. B cells that produce better antibodies are getting selected for, and your immune memory is expanding thanks to that. So that's why 3 doses of the original vaccine still give you immunity to Omicron. Mike Frame asks, how central is the redox balance to health, and how does COVID-19 impact this? Are you talking about like free radicals and stuff? I mean, I'm not really the one to ask about that. Sorry. How does COVID impact that? I don't know. Moving on. Oh. Zach's thinking that because he didn't put a Q in front of his question, I wouldn't answer it. No, I'll answer you too. Thomas asked, when do I still wear masks personally? Mostly on public transportation. So like airplanes. I've taken the train a few times in the past year. I've worn a mask every time. Haven't ridden a bus, really. But, oh yeah, I have. Yeah, I wore a mask there too. Squinny asks, am I right in understanding that new variants are created by mutations to the atomic structure of the surface of the spike protein that increase its ability to bind to human respiratory cells? So, new variants are caused by mutations to the genetic code. And those mutations are random. They're going to happen over time, independent of vaccines or whatever we're doing. And then the successful mutations are going to be selected for. They're going to be selected for whichever mutations offer a fitness advantage, be it binding to human respiratory cells, be it evading neutralizing antibodies, whatever advantage that is strong enough to give an actual fitness advantage to the virus is going to be selected for. And yeah, so the mutations in the genome do affect the proteins and their structure. Generally. There can be mutations in non-coding regions that offer fitness advantages too, but to answer your question. Let's see. Gotta reorient myself here. Okay. Daniel Harris asks, what about nasal spray administered COVID vaccines to ensure mucosal SIGA protection? Is this a thing? Thanks. Yeah, it's a thing that's being studied. I'm not convinced it's going to be any different or any better, really, than the vaccines we have. And from the data that I'm aware of, that it remains true. It's not, they work, but they're not really offering any advantage over current vaccines, because just like your IgG levels, your IgA levels are going to contract in your mucosa, and maybe having memory cells specifically in the mucosa would be beneficial to things like transmission. Beneficial in terms of preventing transmission, that is. But we don't know yet. So I'll be convinced when I see the data. Okay, Zach, you ask, why must 3 old wild-type vaccines still be taken before you can take the new updated vaccines? Because that's what we know gives you the most protection. And then when you have your 3 doses, then you can have a 4th vaccine that is updated to encompass both Omicron and all of its subvariants better than the 3rd shot. At least that's the idea. But I don't even know if you need all 3 shots before taking the 4th shot. I don't know if that's true. I don't keep up with all these policies all the time. Reverend Sasquatch asks, I am new to your channel. Found you through Twiv. You found me through Twiv? Really? Oh yeah, they mentioned me a couple times. Have you covered these claims of a rise in young healthy adults dropping dead from the vax? I think I've covered it. Maybe not specifically in my videos. Hard to remember what I've done sometimes, but essentially, if I haven't covered it in any of my specific videos, there is no increase in young healthy people dropping dead from the vax. It's just not a thing. You hear reports of people dropping dead on sports fields. Guess what? Something called sudden cardiac arrest in athletes has been a thing for years. You can find PSA videos about it going back years. It's when people with undiagnosed heart conditions overexert themselves on a field, and then they suffer heart problems and unfortunately die. And beyond that, there's just no credible claims of increases in young healthy adults just dropping dead. It's just not a thing. You don't see it in any excess death data. You don't see it in any actual studies of vaccine safety and surveillance. It's just not there. Tony asks, question, SADS. My understanding is that heart factors relating to it are electrical in nature and not related to the issues such as myocarditis and pericarditis that rarely present post-vaccination, right? I don't really understand. Heart factors relating to it are electrical. I can't really speak to that. That doesn't sound right, but I'm not familiar with all the mechanisms of heart disease and whether or not it's electrical or inflammatory or just a blockage. Sorry, I can't answer that more. I'm not going to try to teach topics that I don't confidently understand. How much do they pay me to shill so hard? Nothing. I don't get paid to do this. I think it's funny that people think I get paid a lot to do this. I don't. I'm a normal scientist. I have a normal amount of money. I just do this in my spare time. Blanca asks, how many times you pet Toby today? Shut up. I know who that is. But a lot. The answer is a lot. Toby's my dog, for those who don't know. Okay. Uh, will you attach your source material after the show? Yeah, I can do that. I can do that for you. I can post the links to the papers that I talk about here. Just know that it might be a few days before I update this one, and I still have to update my last video. I'll be going out of the country actually later this week, and I'll be out for almost 2 weeks. So, yeah, I'm not going to be as active updating these things. But after that, I'll get right back to it. I'll have weekly videos for the rest of the year after I get back. Deb asks, do you think it was wise for the government to stop sending out free tests? I would have thought I would like that to continue. Testing helps. Testing helps people act accordingly when they know they're infected. And those COVID tests, those rapid antigen tests are expensive. I think one time I bought them at the grocery store, I think they were like $10 a pop. It was crazy. Couldn't believe they were that expensive. It was wild. Maybe it was 10 for 2. I can't remember. But still, it's crazy. Bud Buttons asks, when are you going to be on Twiv? I don't know if I will be. I haven't heard from Vincent. I would go on if he asked me, but I don't know. I feel like he would. My imposter syndrome says that he has better guests to invite. But if he asked me, I would definitely do it. Yeah. Dave T383 asks, will the video with Crawford be edited for audio and reposted? I don't plan on doing that. I don't think I can do it. I mean, I guess I could. I could take the video that I had and take the audio from his and do some editing, but I'm sorry, I just don't have plans to do that right now. If you ask me enough and bug me enough, I might do it, but yeah. Let's see. My name asks, what if I had an infected person breathe into an empty bottle and after a couple of days of letting the viruses deactivate in the bottle, I breathed in air from that bottle? Would that protect me? It depends how much virus is in the bottle. Yeah, that's a weird question. If you breathe in completely inactivated virus, I suppose it could count as an exposure. And maybe you would have an immune response. Probably not a great one, though. If it's not replicating, if it's not coming into your... Yeah, it would just have to be a lot of virus. It's a weird question. Unga Boonga asks, what are your thoughts on human overpopulation, and will it make the prevalence and severity of pandemics worse and worse? Yeah, so actually there was a paper in, it was either Nature or Science, I can't remember now, but it talked about the effects of climate change on pandemics and how climate change is going to increase the rate of zoonotic spillovers and pandemics, because as the climate warms and habitats change and also people move and are displaced, you're going to have a lot of carriers for viruses moving and mixing in ways that might not have happened before. And that would all increase risk of potential spillover. Okay. Any more questions? Let's see. Oh yeah, okay. Is this the next one? Yeah, okay. Imagination Scene asks, what book would you suggest to think clearly about topics like the ones you talk about? Correcting logical fallacies, thinking correctly about stats, etc. It's a general, sort of general topics. So I have 3 books on my bookshelf behind me that I can think of. One is The Invention of Air. One is called Why Science. And the other is called Lies, Damned Lies, and Science. Yeah. Those are all good books to read when on this topic of, logical thinking, logical fallacies, and misinformation. I'd also recommend How to Talk to a Science Denier. That's a good book by Lee McIntyre. Yeah. All right, Zach, you're up again. You ask, why is it better to get infected with Omicron if you've never been infected by the wild type, but taking the wild type vaccine is important before the new one? So because infection is different from vaccination, it's actually known that vaccination induces a much better germinal center response sooner than infection does. So we don't understand all the intricacies that affect these outcomes, but the infection with a virus is going to be not only stress on your body, but also your immune system, because the virus is kind of overdriving your immune system in a way that can be destructive. So we don't see very efficient germinal center formation as quickly as we do with vaccination when you get infected. So yeah, the imprinting is something to do with the infection itself. Whereas a vaccine, you have it's I guess a way to think about it might be you're doing drills over and over again instead of having an actual fire. It would be better for the building to just have a lot of fire drills than to actually have multiple fires. That's a way to look at it. Marion asks, why is the Omicron vaccine not given as a first dose? I don't see any reason why it shouldn't be given as a first dose, but that's the policy. Policy doesn't always follow science. Imagination Scene asks, also, do you think that in the future we will see a rise of viruses. What about the history of viruses? Do you think the amount has been rising? Well, so the amount of virus in the wild has not been rising, but the potential for spillover has. As humans disrupt natural habitats for animals and continue consuming lots of different species of animals in the ways we do, you're just going to have that risk. Okay, Zach, again, you're asking, why are countries like the UK and Denmark not giving the vaccine to younger individuals, even up to 50 in Denmark? That's not what's happening. So, Denmark and the UK, countries all across Europe, are still offering a full 3-dose course of COVID vaccines to all eligible ages. They are just not recommending additional booster shots for anyone under 18. That's it. I've seen that a lot, that claim about Denmark a lot. The problem is people aren't actually reading the policy on Denmark's public health dashboard. Tony asks, quick follow-up, SADS equals sudden adult or arrhythmic death syndrome. I was reading somewhere about this. Seems to be not related to inflammation, but I respect that you won't comment without the expertise. Yeah, I just don't know a lot about the mechanisms. I know it's a thing. I know that it happens a lot. Well, not a lot, but I know it happens normally within the population, and the rates have not increased in relation to vaccination. I'm a normal scientist who gets paid a normal amount equals underpaid. Oh, I feel attacked, but it's true. It's true. A lot of scientists are underpaid. If you don't know how much, so you go. Imagine going to college for 4 years and then going to graduate school for another like 4 to 6 years, getting a PhD, and then getting a job as a postdoc and getting paid like half as much as what an undergrad who just took a normal job out of college would be making after the same number of years. Imagine that. It's not a very attractive career path, that's for sure. But lots of scientists do it because they love science. Okay. Before I scroll past it, Dave asked, what were those titles again, please? So the books, I think, it was The Invention of Air by Stephen Johnson, Why Science, ? What, I don't remember the author name, and Lies, Damned Lies, and Science. I don't remember the author name for that as well. But, and then the fourth book I said was, oh my God, it's How to Argue with a Science Denier by Lee McIntyre. Let's see. Bloodlust asks, touching on your misinformation answer earlier, do you think that as misinformation becomes more rampant, the scientific community will start fighting back more and aggressively combat it? I hope so. I hope that the scientific community commits more resources, more time to tackling misinformation. Because it really is a shame that so much of our tax dollars go toward producing this fantastic basic body of basic research that we have, and allows brilliant scientists to do the work that they do. But then they're in an environment that's, such a work till you die culture. And that they can't have time to go out and tell the public in layman's terms what they found. They write a scientific paper with terms and field specific jargon that makes it so that only people in that specific field are probably going to be most of the people who ever even read it. Like my papers in grad school, probably only a few hundred people will ever read them because they're so field specific. But if scientists take the time to communicate on more accessible platforms, then that could do a lot to explain their work. Because otherwise it's up to reporters to read the papers, interpret them their own way, and then write headlines that are completely wrong. And sometimes even reporters talk to the scientists, but then the scientists, might not be great at communicating, or the reporter might not understand it completely and just want to not really drill down into the issue and deeply understand it before they publish their article. So yeah, I hope that scientific community becomes more willing to address misinformation. And it's hard for me to get a sense of that because now on social media I follow so many other science communicators. I don't know if the attitude is changing, but I hope it is. How much are lateral flow tests in your country? I paid €2, or sorry, is that? Oh my God, I think that's pounds. I paid £2 per test today from a large supermarket in UK. Yeah, last I knew they were like $5-10 a piece, within that range. So yeah, not cheap. Here in Canada, we aren't getting the newest BA.4/5. I believe we get BA.1. How much protection am I missing? Should I go to the US for the newest one that isn't approved here? I don't think you need to do that much. I think a BA.1 vaccine is going to give just as much protection as BA.4/5. At least as far as we can tell right now, I think the protection is just as good. Sally Bruckner asks, why is dose so different between Pfizer and Moderna? Bivalent 15 micrograms versus 25 seems like a big difference. Yeah, so Pfizer and Moderna doses have been, their doses have always been different, and it's just what they tested. So when a company decides to test a drug or a vaccine, they have to decide what the dose is going to be, how it's going to be delivered, how it's going to be packaged, manufactured, all these things. They kind of have to commit to certain things early and take chances, so to speak. So before mRNA vaccines had the success that they had during the pandemic, no one really knew how successful they would be. People were concerned that mRNA was too fragile, that it wouldn't stick around long enough in the body to cause enough of an immune response. So different companies took different approaches. Moderna decided to use a slightly larger dose than Pfizer in hopes that the larger dose would help the chances of the mRNA staying around long enough to produce enough protein to create an immune response. So that's the reason that their doses have always been different. And the difference between 15 and 25 micrograms in the bivalent, that's not really a huge difference. They probably had more reasons than I can say here, but they kind of just were going with what worked before, probably. Okay, Zach, you ask, what's the reasoning behind the U.S. continual consistent recommendations, but the European countries have different recommendations? Not sure. I guess, are you talking about Denmark still? So like I said earlier, policy doesn't always follow the science. Sometimes countries will change their minds on what the policy should be based on what they think is science, or maybe they change their mind due to political pressure. Maybe they change their mind due to a change in power. But the science has been very consistent that 3 doses of vaccine for anybody who's eligible is very beneficial. Okay. Markle Mont asks, how easy or difficult is it to create a new monoclonal antibody? Seems some NYU kidney transplant patients with COVID infections have created mutations which resist remdesivir. Yeah, so it's expected that antivirals will eventually select for resistance. Creating new monoclonal antibodies, I've created monoclonal antibodies before, and it's not easy. But for a company that has the resources and the time, it's definitely doable. The trick is getting lucky. Getting lucky that you get the right antibody. You get the right clone of hybridomas, which are the cells that produce monoclonal antibodies in the manufacturing of monoclonal antibodies. You get the right clone of hybridoma that is going to create the right antibody, essentially. I think that there are probably directed evolution ways that you could use to speed up the process or make it more streamlined. But the way I understand the process, it's not easy, but it's doable. And we do have monoclonal antibodies that work against all variants. Dr. Daniel Griffin talks about them in his clinical updates. Cheryl asks, if you had the choice of any one particular prominent COVID vaccine skeptic individual to live with, who would you choose and why? Pick one to live with. That's a funny question. God, who could I stand to live with? Man, I don't think I'd want to live with any of them. But if I had to choose, oh man, This is gonna be terrible, but I think if I had to choose, I think I'd choose Del Bigtree. Just because he's so wacky. He's like wacky to the point of being entertaining, but then also infuriating because he'll say things that are so bad and so offensive, but then he's also just ridiculous. I don't know. That would probably turn out poorly for both of us, but that's the only person I can think of right now. Ian Merle, do you think it would be beneficial to have statistics of SARS-CoV-2 deaths dividing into vaccinated and unvaccinated? Yeah, there's a website that does that. I can link it when I update the links to this. But it's Our World in Data. They have a page dedicated to posting information from public health dashboards from several countries all over the world that report on vaccinated versus unvaccinated COVID deaths. Zach asked another question. Why did they make new vaccines if BA1 is just as good? Because it makes sense to, if you're going to make an updated vaccine, it makes the most sense to have it reflect what is most prevalent in the population right now. So BA.4/5, I believe, is most prevalent now, unless I missed something in the past few weeks. But BA1, it's still not far off from BA.4/5. It's still the same variant. It's just another subvariant. So it's going to be just as good, I bet. Again, we don't have data saying which one, if either, is better at increasing your protection against severe disease and death. But the difference probably wouldn't be huge. Is it 50 micrograms of mRNA? Yes. The microgram amount refers to the mRNA. Okay, I think this is the last question and then I'm caught up. Bloodlust asks, how close do you think we are to the pandemic actually being over? Are we at a point where dominant variants are mild enough we can treat COVID the same way as the flu with a yearly optional shot? So, how close are we to the pandemic actually being over? I think that the pandemic, the worldwide pandemic, will be over when enough of the world is sufficiently vaccinated. So we have a lot of countries that are still not sufficiently vaccinated. Those countries can act as kind of free range for the virus to have waves of cases that with it bring severe disease. And with each wave, it's going to have an easier time spreading in unvaccinated populations than in vaccinated populations. It'll have less resistance from the immune system. And it's just more opportunity for the virus to evolve. And any week now, we could have a new variant that evades immunity, just like how Omicron emerged and evaded neutralizing antibodies, but not so much T cells. We could have a new one. It could happen. So until most of the world is vaccinated such that, the presence of these variants won't be concerning because we have that immunity, that immune memory that can protect us from severe disease, I think we're still going to technically be in a pandemic. But at the same time, a lot of the world is sufficiently vaccinated. And those countries that are highly vaccinated are experiencing a lot less death, hospitalization, severe disease, thanks to vaccines. So the pandemic's really over when people decide it's over, essentially. So I know that's not a very simple answer, but I think the reality is complicated. Okay, one more question here. JMQS, is the RNA integrity of the mRNA in the bivalent products higher than 85%? Is the integrity of the mRNA higher than 85%? I'm not sure what you're asking. Yeah, I'm not sure how to answer that question because I'm not sure what you're asking. Okay. Dahmer on Netflix. You know, I listen to a lot of true crime podcasts, but I haven't watched Dahmer yet. I hear it's good. But it looks like questions are winding down in the chat here. Like I said earlier, I'll be out of the country later this week, and I'll be gone for almost 2 weeks. I'm going to try to have new content. Well, I'm going to try to have videos upload while I'm gone, but I haven't made them yet. So if I don't, I'm sorry. If you're a patron, feel free to not do this month. That's fine. I'll get back to my weekly upload schedule after I'm back. So, and when I come back, I'll be covering a lot of funny things. Okay. One more question. What seems to be the rate of incidence of long-term symptoms post-infection? I don't know numbers off the top of my head. It's a significant fraction, but I don't know numbers off the top of my head. Some countries are reporting that their workforce is feeling the effects of long COVID. Thoughts on Paul Offit? I did talk about Paul Offit earlier. The gist is that he thinks that, or he wants to see data that bivalent vaccines are going to be better than what we have. So he doesn't think that they're worthwhile right now. But he does think that COVID vaccines, 3 doses is what people should have. And that's fine. He can disagree. It's fine to disagree in science. What happened to the fro? I didn't pick my hair tonight. I'm exhausted, and I didn't pick my hair. Because that means after I pick my hair, I gotta shower, and I want to relax after this. Okay, JMQ is clarifying their question. First generation products had 55 to 85% of the mRNA contained being what it's supposed to be. I'm not aware of those data. I'm not aware of mRNA vaccines. Each lot has to be validated for potency and contents, and I doubt that 55% would be an acceptable pass. So I doubt it. All right, well, it's 10:15 here where I am, so I'm gonna call it a night. And head to bed. So thanks all for showing up. Thank you, Sandy, for moderating. I appreciate it. Everyone go check out Sandy's. Everyone go check out one of my moderators' channels. Environmental Coffee House. Right? That's it. It's a great channel. Covers climate change misinformation. Yeah, Environmental Coffee House. All right. So, yeah, have a good week, everybody. I'll see you next time. Take care.